For our group presentation, we have chosen question 29. The question is, use physiological and biomechanical theory to propose the optimal properties of footwear to enhance middle distance running, for example, increase performance, running economy, and decrease injury risk. Our team consists of Chris, Hussein, Erdem, and Arden. Introduction. So the introduction. This study will focus on the optimal properties of footwear. We are going to analyze these properties and relate them to how one can enhance their performance in a middle distance race. We will also investigate the injury risks associated with the footwear. We will highlight the effects of these footwear properties in relation to performance and injury. Furthermore, we will then discuss the ways of overcoming these issues in order to successfully answer our question. We define a good training shoe as a shoe that provides cushion, support, flexibility, softness, and lightness. The outer sole should also have the same characteristics as being flexible, soft, and lightweight. I will now pass the presentation up to Chris, who will then talk about knee problems and cushioning.
Okay, there has been not been much research studies carried out to identify the impact of footwear on athletes' somatic performance. However, there has been some discussion amongst the research that do make some reference to the consequences of inappropriate footwear in middle distance running. Firstly, Little and Bramwell, 1984, estimated there is 50% probability of knee problems occurring in athletes who run between 50 to 70 miles per week, for example, middle distance runners. Cook in 1985 stated this is due to the repetitive loading of the knee joint, which is greatly affected by shock absorption characteristics of the footwear. This has been related to the hardness of the midsole of the shoe as declared by Harding in 2001. These findings speak volumes about the effect of footwear on runners, and as you might imagine, this can significantly impair the performance of the runner. However, we have discovered that this issue may be addressed by having an increased level of cushioning in the midsole of the trainer. A study by James in 1978 provides support to this idea. James found that properly cushioned footwear can reduce injury risk. This is also supported by Harding in 2004, who found that shoes without cushioning cause increased knee flexion velocity, which increases the load on the knee joint. These findings back up the evaluations of Cook in 1985, who concluded that knee injury is a result of repetitive loading on the joint. Finally, these discoveries suggest that the cushioning on the midsole is an important property of footwear in terms of injury risk reduction. Now, I'm going to pass you on to Hussein, who is going to talk about overpronation and knee injuries.
We also thought that it's worth mentioning the adverse effects of overpronation during running. Overpronation means excessive shifting of weight from the outside towards the inside of the foot during running, suggested by Johnson et al. Henning, 2001, identified that overpronating during running is strongly linked with knee injuries. This has been found to be particularly common in females. It may therefore be suggested that running shoes, particularly women's running shoes, should provide adequate protection against overpronation. Heel striking. Johnson et al. 1984 discussed the effects of heel striking during running. He also stated that heel strike causes substantial strike to the foot. This causes severe soreness to the foot. He also presented interventions using flat bladders in the shoe arranged to support the heel portion of the foot of the user, and the second flat elastomeric bladder supported by the shoe to support the weight of the ball portion of the foot of the user. This has been found to reduce shock absorption, and this should be a recommended property for reducing risk and improving performance. I'm going to pass you back over to Arden now.
Now I'm going to talk about footwear, injuries, and prevention. It has been scientifically proven that footwear absorbs shock and impact, which is supported by Kong et al. 2009. Nevertheless, Kong et al.'s 2009 evidence has been separated into two proposals. The first one is footwear can decrease the number of stress fracture injuries. The second proposal is it has been argued that viscoelastic materials has not been deemed effective in lowering soft tissue injuries. Nevertheless, Kong et al. 2009 has looked into old shoes versus new shoes. he has said, new shoes have been successfully tested to decrease the amount of shock and impact an athlete feels whilst running. New shoes contain a foam polyprimer of ethylene and vinyl actate, which is also known as EVA, which can be located in the shoe's midsole. These shoe characteristics absorb energy from ground impact. More recently, embedded air, gel rubber, and altered EVA and springs have also been used in the midsole, all with the same objective to further absorb ground impact and decrease the chances of soft tissue and stress fracture injuries occurring. Kong et al. Also believes it is hard to identify new shoes. This is because you can't determine how many miles a shoe has run, therefore making testing and results less reliable. And now we're going to pass it on to Erdem, who will talk about tibialis posterior tendinitis injury.
Tibialis posterior tendinous injury is one of the injuries which could occur from having a bad footwear or from run long distances. Advisors 2015 have said that tibialis posterior tendinosis is a condition characterized by tissue damage and sometimes swelling of the tibialis posterior tendon, usually following overuse, resulting in pain located at the inner aspect of the lower leg and ankle. Tibialis posterior tendinosis is usually an overuse injury which commonly occurs due to repetitive or prolonged activities. This typically occurs due to excessive walking or running, as Johnson 93 states. Mann and Thompson 1985 has stated that it is more common in patients with poor footwear, poor foot biomechanics, such as having a flat feet or having inappropriate footwear, and in those who have had a recent increase in training or activity. Tibialis posterior tendinosis is commonly seen in running sports such as football, hockey, and athletics, particularly in distance runners. Overcoming the injury. An athlete could overcome this injury by seeing a typical therapy to rehabilitate the tendon and muscle, or seeing an orthopedic surgeon, which could advise to having personalized footwear. Now I'll pass it on to Chris, who will talk about the hemolysis.
Okay, another physiological adaptation, or one physiological adaptation of poor footwear is hemolysis. Another reason why cushioning in running shoes for middle distance runners is recommended is the potential onset of hemolysis. Hemolysis means the increased destruction of red blood cells, as supported by McClatchy in 2002. It has been discovered that during running, shoes with hard midsoles in fact, limited cushioning, in other words, can cause the onset of hemolysis when compared to shoes with more cushioning and subsequently softer midsoles. This is found by Buckle in 1965 and supported by Dressendorfer et al. 1992. I'll now give you back to Erdem, who's going to take you through the video analysis of something I performed.
As a group, we have done a little exercise, which we used Chris as the participant. We have analysed Chris running in two pairs of trainers, first one with football boots and second with the casual trainers. From the results that we've analysed, we could see that Chris overpronates more in the trainer 2, so with casual trainers, compared to his football boots. And when we look at the trainers, it could be seen that trainer 1, so football boots, are designed from lighter weight materials compared to trainer 2, as Smith and Bunch 986 explains that lighter trainer maximizes energy return and do not restrict movement and desirable motions. All of these factors combined go some way to explain the participants' enhanced performance in trainers 1 compared to trainers 2.
As a conclusion, it is apparent that cushioning could reduce the chance of injury, particularly in a knee, as it proceeds as a shock absorber. Additionally, an athlete could seek help from an orthopedic doctor to help with this issue.
There were not much research on physiological effects of footwear on middle distance runners. Therefore, it could be an area for future research.
As a biomechanical analysis of the footwear, it is concluded that a middle distance runner could face various injuries and obstacles due to bad footwear. These injuries could include soft tissue and stress fractures.
Advice for middle distance runners is to design and personalize trainers to meet their needs in order to avoid injuries and perhaps enhance performance. And this is our reference list. Thank you for listening.